and the like. In the house today, we have chiefs coming in from selected provinces from the country. We have chiefs coming in from Shamba, Mutare, and Mutasa. These are districts dotted around the country of Zimbabwe. One thing we are proud of as a nation is the coordinated effort that we put in terms of ending issues to do with child marriages. our response to child marriage is so coordinated that it involves the CSOs, government, traditional leaders, and religious organizations. It's something that we are proud of. It's well coordinated, and our efforts are bearing fruit. Thank you.
Thank you so much. Can the Afumu tell us how are you? Can the chief say hello? Thank you so much. Thank you. I'm going to Mozambique. Say, I want someone to introduce the chiefs and the chiefs to wave at us and say hello. To introduce the chief Mozambique.
Bon dia.
Bon dia.
We have here in the room 6 community leaders. I will ask them just to say their names. Can you hear me?
Yes, we can hear you. Go ahead.
Yeah. The translator will support them.
Okay, thank you. We can't hear you now. We can't hear you
now. Community leader.
Okay.
So that's Mario Felipe Gamba, Madonga community leader, Jangamu district. Francis Joel Bambamba. So that's Gimeresu community leader in Kumbana district. Locality. So that's from the Kwasi community leader. Katarina is her name.
Thank you.
That's in Jangamu district.
Thank you.
So that's Joanki Sabang Kumban.
Thank you.
So that's Malaisa community leader.
Thank you.
Albertina Fabian.
Thank
so
you.
That's Magaisa community leader.
Thank you.
Pedro Rafael.
Thank you.
That's Yogo, community leader.
Thank you.
Thank you so much. We have also some child protection committees members and the youths are here. And we have 2 groups we call Masungukati and Masungudota. I will ask the translator to explain to you what does it mean to be Masungukati or to be Sungudota.
Okay, thank you.
Well,
thank
basically,
you so much.
So basically what we call Masungukati based at the community level, a group of women who have the role to provide advice or counseling. So when it's Masungudota, a group of male who are also based at the community level to provide counseling or advice.
Thank you so much. Thank you so much, Mozambique. Is Zambia ready, Lynn?
Yes, we're ready.
Okay, please introduce the Afumu there.
They will introduce themselves.
Okay.
Yes, they can sit, sir.
I am Chief Mabumba of Mansa District in the province of Republic of Zambia.
Thank you.
Thank you.
I'm Chief Kalasal Kangaba from Mansa District, Luapula Province of Zambia.
Thank you.
As we should clap for our chiefs. Let's clap. Zambia is on fire. We are supporting our chiefs.
I can see that, Lynn. I can see that. They are all on fire.
I'm Chief Matanda of Mansa District of Zambia.
Thank you so much, Afu. Thank you so much.
I'm Chief Kalawa, Mansa District, Luapula Province of Zambia.
Thank you so much. Thank you so much.
Good afternoon, panel.
Thank you. Good afternoon.
Doctor,
Yes.
Mansa Luapula Province.
Thank you so much.
Yes, you better recognize Zambia is on fire.
We need to catch some fire from Zambia, everybody else. We need to catch some fire from Zambia.
Good afternoon. My name is
afternoon.
Israel Ines, Chief Chamuka, the 6th of Samba District, Central Province of the Republic of Zambia. Thank you.
Thank you so much, Chief Chamuka. Thank you so much.
Thank you.
Are we done with the fire?
Yes, we're done with the fire.
Okay, thank you so much. So I can't see Tanzania. Meti, please check for me, Tanzania. Malawi, are we back? Malawi, are we back? Anzanga, mulipo? Okay, I need someone to introduce their fumu in the room and to please for me so we can move on.
Hi Jenny. Hi Jenny.
How are you?
The chiefs will introduce themselves, so I'll give it over to them now.
Okay.
Jennifer.
Hi, Jennifer.
Hi. Udibwino afumu? Udibwino.
In Senior Chief Chikumbu Kumulanje.
Ozikomo. Speak in English now. Everybody else is speaking.
Okay.
I'm the only person who speaks Chichewa here. So please speak in English.
Okay. Hi, everyone. I'm Senior Chief Chikumbu from Mulanje.
Zikomo afumu.
Good afternoon, Senior Chief in Tutamanja, Mulanje District, Malawi.
Zikomo. Anybody else, or we only have two?
We also have two more chiefs.
We are waiting.
Yes, just two more chiefs.
Good afternoon, everyone.
Good afternoon. How are you?
I'm fine, and how are you?
I'm fine.
I'm Group Village Head Woman Tambala, Senior Chief Chikumbu, Mulanje, Malawi.
Hello.
Hello.
How are you?
You're fine. How are you?
I'm okay.
I'm Group Village Head Manabu, Senior Chief in Tamanja, Malawi. Thank you.
Thank you very much. Thank you.
Oh, wow, Chief Jenny, thank you.
Thank you so much. Thank you so much. I love the energy in the room. I think we all needed tea. You did not tell us you had not taken tea when you were starting in the morning. Now everybody is all smiley. I can see smiles from far away. So I can see smiles from far away. I'm waiting for Tanzania. When Tanzania joins us, we are going to go for their introduction. But next we have an amazing panel, and it's on, let me just project it. It's on the impact of COVID-19 on ending child marriage and teen pregnancies. So I'm hoping we can be able to learn, as you had young people earlier speaking on the different aspects of teenage pregnancy. So I'm hoping we can be able to learn and what different governments have done on ending teenage pregnancy. So in this panel, we have a few people. So in this panel, we have a few people I would want to introduce. So we have a country representative. We have Alinkisa Mpongolo from 18 Plus, okay, who is going to give us a presentation from 18 Plus Malawi. I hope your presentation is ready, Alinkisa. Oh, please, I hope I have not murdered your name. Alinkisa?
That's okay, Jenny.
Okay, thank you. So you can do your presentation. You had been given 15 minutes, but people have eaten into their time. So I'm going to give you 7.5 minutes. So try to do your presentation 7.5 minutes because of time. Thank you so much.
Can you enable me to share my screen, Jenny?
Okay, just give me a second. Okay, you can now share.
Thank you. Can you see my screen, Jenny?
Yes, I can see it. Go ahead.
All right, thank you so much. Good afternoon, everybody. Good afternoon, colleagues. My colleagues from right here, Malawi, Zimbabwe, Zambia, and Mozambique. I'm going to give you a presentation on the impact of COVID-19 on ending child marriages in Eastern and Southern Africa. Allow me to start by saying the coming in of the COVID-19 pandemic affected a lot of the way we do things. That pretty much affected everything, from the health aspects to the economic aspects, and even it undermined efforts to end child marriages. We saw governments trying to put in place different measures just to curb the spread of the virus, and there were lockdowns initiated in different countries. In addition to the lockdown, we saw strict measures that were put in place just to make sure that the spread of the virus is reduced. And when all this was happening, we actually saw an alarming increase on the numbers of child marriages, the cases of child abuse, the cases of rape, and other child rights violations across the various countries. And as the lockdowns were initiated in the various countries, that means a lot of the children across the countries, let me say across the world, were out of school. Statistics show that close to 1.6 billion children across the world were not in school. And for sub-Saharan Africa, where the 18 Plus DMZ project is taking place, we had close to 250 million children that were not in school. And it is against this background that Plan International, with leadership from our Center of Excellence in Zambia, conducted an assessment to establish the impact of COVID-19 on our efforts to end child marriages. And of course, this was in reference to the SADC model law on ending child marriages, as well as the African Union common position in ending child marriage. So my presentation will focus on several things. I'll look at why the assessment was conducted. We'll look at the methodology, and then I'll give you the results of the assessment. And we'll also look at the measures that different governments and CSOs put in place to reduce the impact of COVID-19. And then we'll move on to look at the recommendations. So the assessment was conducted pretty much to establish the impact of COVID-19 on ending child marriages in reference to planned efforts stipulated in the SADC model law on ending child marriage and protection of those already in marriage, as well as the African common position on ending child marriage. The assessment was also conducted to inform the development and alignment of programs and advocacy strategies. And now, as I said earlier, our Center of Excellence in Zambia is the one that led this process. But let me also mention that Plan International conducted this assessment with partnership from other international organizations like UNFPA, UNICEF, Girls Not Brides, and Rosario Memorial Trust in Zimbabwe. So moving on to the methodology that was used, a participatory and integrated approach was used in collecting data. And of course, this was complemented by quantitative secondary data. The study was conducted in several countries: Egypt, Kenya, Malawi, Uganda, Sudan, and Zambia. And as I said, it was a participatory engagement, which also involved several people like parliamentarians, representatives of civil society organizations, government officials, young people, as well as our traditional leaders. The study also collected secondary data from Eastern and Southern Africa, and this was, of course, from data sources like legislation, approved program documents, and rapid assessments that were conducted across the countries. Now, moving on to some of the results that the assessment revealed. I'll just give you a snapshot of the results. I'll not mention every single thing in view of time. To begin with, there was an increase in terms of child marriages. As I said earlier, to say child marriages increased. Also, we saw an increase in terms of the numbers of child rights violations, the numbers of the cases of children that were reporting cases of rape, as well as defilement. And just to emphasize on that, COVID-19 brought an impact on the risk. It increased the risk factors that drive child marriage, as it exacerbated several intertwined complex factors that drive child marriage, and also disrupted the way organizations work around the world. To provide just a bit of some data in terms of the numbers of the girls that were at risk of child marriage before COVID-19, and those that additional girls that were put at risk after the coming in of COVID-19. I hope you can see my screen. That just shows some of the figures. And this was the source of this data is a Pan-African Girl report that was produced last year. Now, moving on to some of more of the results that the assessment revealed. The assessment revealed that there was limited service delivery. The lockdowns had negative impacts on delivery of education, sexual reproductive health, child protection, as well as SGP services. As I mentioned earlier, and also let me allude to some of the speakers that spoke earlier, we saw that COVID-19 put a lot of things to a halt. Schools were closed. That means children were not in school, and also the normal sexual reproductive health services that our young people access in the communities were not easily accessible because there was restricted movement because of the lockdowns, as well as the restricted measures that were put in place to curb the spread of the virus. For some young people that were close to the health centers, some of them were in a position to access these services. But for some that live far from hospitals and health centers, accessing these sexual reproductive health services was a challenge. The assessment also revealed that there was increase in terms of levels of poverty. The pandemic exacerbated poverty at individual and community levels, therefore contributing to child marriages. We're all well aware that poverty is one of the reasons that drives parents into forcing girls into child marriages, but also sometimes it forces girls themselves to get into marriages. As one of my colleagues alluded to earlier, if they lack the basic needs at home, and then if there's somebody else who they see that can provide for them, either you find sometimes girls get pregnant and that forces them into early marriages. Also, we saw that during COVID-19, especially during 2020, when the first wave of COVID-19 came, some companies and organizations retrenched some of their staff. This meant people had less money to spend and buy the things that they need. Obviously, if people or parents had less money to spend and provide for their children were put in a position where they were either forced into child marriages or wanted to find results to them providing for their needs. Another thing that the assessment revealed was weak legal and regulatory frameworks. The assessment revealed that most of the laws had loopholes and that allowed for child marriages. So that was either lack of adoption or implementation of the policies and laws that seek to protect children.
Sorry, just a minute. Are you able to project? You're seeing like 3 screens. Are you able to do like presentation so that we can see some of the text is not visible?
All right, allow me to do that.
So you can remove the split screen.
That's the screen. Is that okay, Jenny?
That's fine, thank you.
All right. So, I was talking about, some of the results that the assessment revealed. Talked about the weak and legal regulatory frameworks, but also unsafe and insecure environments. I think from what we know, child marriage is associated with sometimes instances where parents want to protect their children or the dignity of the family, and then it turns out that sometimes parents will end up forcing the girl into marriage. Sometimes it's because most of the times girls get pregnant, and as a way of preserving the reputation of the family, parents force their children into those marriages so that they don't look like their child got pregnant out of wedlock. The assessment also. Okay, now moving on to the some of the national adaptation laws on child marriages. There are several promising laws and programs that have recently been. Several promising laws and programs have been recently made, which have either been informed or developed to support the implementation of regional laws or commitments. For instance, the SADC model law and the AU common position on ending child marriage. The study revealed that I think all the countries that participated in the study, as I mentioned, Malawi, Egypt, Sudan, Mozambique, all the countries except for Sudan have developed policies that set the minimum age for marriage at 18. And across, of course, all these 6 countries, there was a bit of limited information in terms of alternative policies securing the interest and safety of girls and boys against the impact of COVID-19. Now, as the pandemic affected the way we do things, different governments put in place measures that curb the impact of COVID-19 on child marriages, as well as curb the spread of the virus. I'll share three of the measures. I'll categorize them as educational. Some of them are protection, and the others are to do with health. Now, in terms of educational measures, we saw that during the time COVID-19 came through 2020, there were introduction of online lessons using tablets and TVs, and as well as radios across different countries. Just to be specific on that, for Kenya, Malawi, Zambia, and Sudan. This was done to ensure that girls and boys continue learning amidst the school closures. Also, we saw that Egypt split their learners to reduce split the learners in class to reduce the number of learners in class attendance. At the time the study was being conducted, it was Egypt that was doing this. But then as time went by, we saw that other countries also did the same. To speak specifically for Malawi, we saw that after children went back to school, shifts were introduced in the different classrooms just to make sure that the kids are not crowded and they continue to learn at the same time they are protected from catching the virus. But also there were awareness campaigns with parents and students on COVID-19 as well as their preventative practices. We also saw the promotion of hygiene practices such as washing hands, social distancing, masking, as well as ventilation in the classrooms. Different governments also provided radios, as I said earlier, and tablets to poorest families just to ensure the continued learning for the children that were not in school. But also after these measures were put in place, where you had hand washing, the social distancing, the aspect of shifts, we also saw that there were different awareness campaigns that ensured that children return to school and that schools are opened and life continues. And in addition to this, there was provision of clean water to the different schools, so that children as well as the teachers in the various places wash their hands and protect themselves from COVID-19 and continue with their learning. Now, moving on to some of the protection measures that were put in place, we saw the establishment of emergency liquidity assistance from it, for instance, for the Malawi government. This saw the suspension of interest for the banks and also principal payment for microfinance institutions. All this was done to mitigate the impact of COVID-19. And for Zambia, we saw the provision of emergency cash transfers to provide temporary emergency support to the most vulnerable households already on social cash transfer, and also included the horizontal expansion to include informal workers and prevent family separation due to the effects of COVID-19. There was also strengthening the technical capacities of Women's Complaints Office with the UN Women, and this the government of Egypt worked together alongside with the UN Women. There was also provision of GBV shelters through the Ministry of Social Solidarity to support women, girls, and boys who were victims of violence. This support included endorsement of new protocols that ensure that they are protected as well as that they are assisted if they're reported any cases of violence. Now, what were some of the health measures that were put in place for adolescents? We saw the assessment revealed that governments collaborated with private institutions and CSOs to ensure that adolescents had access to health information and products during COVID-19. We saw this in Egypt, Malawi, Zambia, Mozambique, as well as Uganda. The assessment also revealed that mobile and remote integrated health services were provided to the community. Specifically, this was in Kenya. Various governments also provided PPEs for teachers and students prior to reporting to school and reopening of schools. So this included buckets for washing hands, masks for students, and and PPEs for the teachers. There was also stakeholder engagement in terms of ending child marriages. So CSOs came together with religious organizations as well as worked with government in making sure that girls are protected from entering into child marriages. As well as the restricted measures that were put in place to curb the spread of the virus. We're making sure that following the results that I've talked about and that the study showed, there were different recommendations that were put across and were provided. The recommendations went to government, CSOs, as well as traditional leaders. What I've talked about and that the study. Now here are some of the recommendations that were provided. Governments should continue to prioritize the development of innovative ways of learning through e-learning, television, radios, or tablet-based tablet use that boys and girls continue to learn amidst should there be lockdowns or restrictions. This will include identification of alternative learning platforms for adolescents who cannot access e-learning platforms or lessons over TV or radio. We saw that COVID-19 also showed us that there's a big digital divide between youth in the rural areas and those in the urban. Some could access lessons over TV or radio and through tablets, but some could not access this. Therefore, this recommendation just emphasizes on the need to find alternative ways so that at least even the hardest to reach young people, boys and girls, can continue to learn amidst lockdown or restrictions because of the COVID-19. Governments should also ensure that adolescent sexual and reproductive health services are classified as essential services during emergencies, including COVID. And this will ensure continuity of services and also prioritize support towards enhancing adolescent access to specific SRHR services. I think one of my colleagues alluded to that earlier as she spoke to say, I think there was much focus on protection from contracting the virus to the point that issues of protection maybe were not for protection, in this case specifically SRH services, were not put across as an essential service. And thus we saw an impact on that to say there was increase in terms of the child marriages as well as the teen pregnancies across the region. Another recommendation that came from the study was that CSOs should implement separate adolescent spaces for adolescent sexual and reproductive health and rights, as well as DPP services. And that means supporting governments to ensure that all essential SRHR services and DPP services are integrated in primary health care. Another recommendation that was put across was the need for support and enhanced engagement with traditional leaders and religious leaders, as well as adolescents and community members in developing community-level interventions in line with human rights and national level that address harmful gender norms. I think this cannot be overemphasized, as we know that our traditional leaders are the ones that stay close to the people, and people do listen to them when they speak. There's therefore a need to continue to engage them, even when addressing issues of child marriage and teen pregnancies amidst the pandemic. And to finish with the two recommendations that the study provided, it was also recommended that CSOs and government departments should engage traditional and religious leaders to improve access to schools, health services, and products, as well as social welfare to adolescents, and to scale up delivery of advocacy to end child marriage, teen pregnancies during and after the COVID-19 situation. Just to emphasize on what I talked about earlier about traditional leaders, that they should also support efforts to implement the re-entry policy. I think this is something that Chief Chimuka talked about earlier on in his presentation. That traditional leaders should support governments and schools with the back-to-school campaign, so that if girls happen to get pregnant, they should be supported to go back to school and complete their education. This marks the end of my presentation. Thank you very much, Jenny. Over to you.
Thank you so much for a very enlightening presentation. So to dig deeper into what your name, I need to get a short form of your name. Alinkisa. So to dig deeper in what Alinkisa has said, so we have a panel of experts, both government officials and chiefs, who are going to dig deeper and just to understand this topic better on teenage pregnancy and the impact of COVID-19 on ending child marriage and teen pregnancy. So in my panel, I'll be moderating this particular panel. My panel, I have Kaira Moses from Department of Gender from Zambia. Kaira Moses. Kaira Moses, are you there?
I'm here. Hi.
Okay, hi.
Hi.
And then we have Confidence Mungai from Zimbabwe, Ministry of Women's Affairs, Small and Medium Enterprise Development. Mungai.
Morning, how are you?
Morning, how are you? And then we have from Mozambique, we have Vadmir Nomia from Mozambique, who is from the Ministry of Gender, Mozambique.
Yes.
Vadmir.
Good afternoon.
Good afternoon. Thank you so much. And then we have, thank you. And then we have Senior Chief T.A. Chikumbu from Malawi. And then we have, good afternoon, Chief.
Good afternoon. I'm here.
And then we have Chief Filippo Komba from Tanzania.
Yes, good afternoon.
Yes, good afternoon. So I'm going to go to my first questions. How do you describe the situation in your respective countries? For example, in Zambia, in Mozambique, in Zimbabwe, how do you describe on the impact of COVID-19 on child marriage and teenage pregnancy?
Okay, can I speak in Portuguese?
With Zambia.
Hello, this is from Zambia.
Yes, Zambia.
Of child marriages and teenage pregnancy during the time of COVID-19, it really was quite a blow, because it had started, the rates of child marriages had started increasing when during the time of COVID-19, especially during the time when there was some kind of a soft lockdown, where essential workers like social welfare workers, community development workers were told to be working in phases. And children were told to stay at home, and schools were closed, universities were closed. So the challenge that we had was that some children in homes, and including women, they were experiencing some kind of because some of them were being abused by the people in their homes, and there was no access for services that provide helping people to stop child marriages. There was no linkage between service providers and the victims. And not only that, the other problem came in because parents could not see a future in the girls in going to school, especially when the schools were closed. Nobody knew when schools were going to open. So most parents in rural areas, they preferred maybe their children could be married off so that they can find a way of livelihood. They can find a way of keeping their children, because even the economy started going down, and there was no business. No one was finding anything to do. Those who are just dependent entirely on businesses were going down. This also led to affect the girls. Some girls even went into the issue of being involved in brothels and the like. And there was no much manpower, because even the bars and the restaurants, the bars were closed. So the drinking places were closed. So what happened was some people opened private drinking places that are illegal. And so it was difficult to go and locate those drinking places and arrest the perpetrators. So because of that, some girls were going into those drinking places and And that's where they were trying to find livelihood there. So it was quite a challenge, and it was very difficult to try to locate the girls, because those drinking places, they are not registered. Even there were brothels that were not registered, that are in private homes. So it was very difficult to get to reach those areas and try to help out the girls and help the girls who are being abused. Girls were being married off privately, and because of that, I think the situation was bad, and girls were getting pregnant and they were getting married, both in urban, the Shako areas, and also the rural areas. So this basically was the situation when COVID-19 struck in. But later on, the government took charge to start harmonizing the situation. But since you just asked us about the situation, I'll end here and then come later to talk about the solutions. Thank you.
Thank you so much, Zambia. You know, I'm listening to you. I'm looking at child marriage and teenage pregnancy as a result of economic exploitation. That is huge, and where there was no linkage, a very fluid kind of case management system. So which resulted to an increase in child marriage and teen pregnancies, right? What is the same situation that we are seeing in Zambia? I'm sorry, Zimbabwe. Zimbabwe.
Yes,
Zimbabwe,
hello?
are you with us?
Yes, thank you. Hi, how are you?
Hi, please switch on your camera so that you can see your beautiful face.
Oh, thank you. It's okay. Well, the situation is quite similar to what Zambia has experienced. You see, Zimbabwe, I think, has witnessed about 2 lockdowns, which have been these were continuous in terms of the lockdowns that we have experienced in Zimbabwe. But you'd find that lockdowns bring travel restrictions, which ended up bringing a disruption in terms of service provision. For the service providers, those that respond to gender-based violence and the like, you would find that there were some sort of restrictions whereby you get to a service provider, they are not able to offer services because we are observing the travel restrictions and lockdown regulations. Consequently, you also find that the economic stress was also felt, whereby lockdown brings about some job losses, salary cuts. There's this restriction in formal business activities, of which, if you look at the economy of Zimbabwe, informal sector plays a big role in terms of bringing livelihoods to the various households that we have. So with the lockdown, there was this economic stress that was coming from the lockdown. You'd also notice that once these economic shocks are felt at the household level, you then find that there's a compromise in terms of the availability of menstrual hygiene services for the girl child. You'd also notice that we are still in the lockdown. Schools have gradually opened, but because of the lockdown, there was this economic stress that would then consequently result in someone failing to pay fees for the next semester or for the next term that has just started. So you'd find that there are quite a number of school dropouts from the lockdown situation. So you'd also notice that school dropouts have also been witnessed, and we are continuing to witness these school dropouts. There was an increase in cases of domestic violence and gender-based violence generally. So you then find that once, in some families, once the girl child starts to witness these cases of domestic violence, you would also witness some cases of some girls fleeing their homes because of the increased domestic violence that has been happening in households. So someone would then decide to get married as a way of coming away from that family which is witnessing domestic violence. So I would say, yes, in terms of the Zambian experience, we are more or less the same. You talk of the teenage pregnancies. These were on the increase in Zimbabwe. I think as we go on, I'll share with you the statistics that the Ministry of Women Affairs, Community, Small and Medium Enterprises has actually gathered. These statistics are quite huge if you look at them because of the lockdown. So in short, I would say The Zambian experience is similar to us.
Go on. You just said about statistics. We'd want to know, like, what numbers are we? Because you said it's increased, you know. So we'd want to know, like, what are these numbers we're talking? How has it increased? Is it from 2 to 4, or is it 2 to 20? You know, that will have an impact. So as we're looking for solution, we'll know that the magnitude of, even if only one girl getting pregnant below the age of 18 is not acceptable, how many of these girls do we need? What kind of interventions do we need? So what are these numbers are we talking about?
If you look at the Zimbabwean experience, since the lockdown, 4,959 girls have fallen pregnant, and 1,174 cases of child marriages have been recorded. So since the inception of the lockdown, these figures are just too huge if you look at them. So this was a report, this is an extract from the report that was presented by the minister in Parliament. So you'd find that these figures are quite huge.
Thank you so much. I don't know how to speak Portuguese, but I'm hoping, Viadamir, you'll be able to understand. As Zambia has said, economic exploitation leading to increase in teenage pregnancy and child marriages. A fluid case management system. Zimbabwe is talking about lack of services and economic stress pushing girls to get married, and issues like lack of menstrual health, hygiene kits, you know. So is it the same case in Mozambique, or do you have different issues? And what are these issues, and how big is this issue, the impact of COVID-19 to child marriage and teenage pregnancy?
Yeah, okay, good afternoon all. I'm here.
Good afternoon.
Do you hear me?
Yes, go ahead. Did you hear my question?
Yeah, but I will need to translate.
We have a translator somewhere in the Mozambique group.
Yeah.
Are you able? We have an interpreter. The Mozambique group, there's an interpreter in that group who can help us.
Okay, if it's possible, can I speak in Portuguese?
Yes, just speak in Portuguese and then you can come and translate for us. Thank you.
Yeah, okay, thank you. Na verdade, em relação à questão que foi apresentada sobre o impacto da COVID-19
As regard to the question which raised on COVID-19.
Okay, just wait for him to finish and then you can come and interpret everything.
Can I go? Posso continuar?
Oui, yes.
Ok, como eu dizia, em relação ao impacto da Covid-19 nos casos de violência, nos prematuros, assim como gravidez precoce, é importante dizer que, de facto, é uma realidade. A experiência do Zimbábue, a experiência da Zâmbia, são experiências similares. Pese embora que nós, o nosso país, o governo, não chegamos ao estado de ser decretado lockdown, mas as medidas foram criadas sobre fraca circulação, fraco acesso aos serviços, de certa forma contribui para que os casos de violência ao nível das famílias, ao nível das comunidades fossem extremamente um pouco maiores. Mas se olhando para aquilo que foi a estatística, casos denunciados, sobretudo, nós vamos observar que os casos foram bastante poucos, muito poucos, estamos a falar abaixo de 2.000 casos, abaixo de 2.000 casos foram os casos que foram registrados ao nível das autoridades, concretamente a polícia, assim como, vou falar a polícia, assim, através dos gabinetes de atendimento. Mas aquilo que é a realidade, né, ao nível comunitário, muitos casos não foram denunciados. Há evidências de que alguns parceiros das organizações civis trabalharam no sentido de obter qual foi o impacto da Covid, o que está a acontecer ao nível das... Em todo caso, de facto, isso constrangiu aquilo que é o curso normal da cidade, do curso normal daquilo que é a socialização das famílias, e faça isto, o governo encontrou meio termo para suprir essas dificuldades. Uma das medidas que foi tomada é que foi-se aliviando gradualmente aquilo que são as situações de confinamento, mas também foi introduzido o subsídio para as famílias carenciadas, por forma a suprir as necessidades. Porque em algum momento, se nós fazermos um retrato, vamos observar que os casos de violência aconteceram porque ou as famílias estão desprovidas de recursos. Então, essa era uma lacuna que, de certa forma, poderia propiciar a existência dos casos de violência. E esse subsídio, de certa forma, vem a suprir aquilo que são as necessidades das famílias carenciadas e para evitar que essas famílias pudessem entrar em circunstâncias extremamente complexas e aumentasse a gravidade dos casos de uniões prematuras, assim como das gravidezes precoces. É claro que as violências aconteceram e, na sua maioria, essas violências acontecem no seio familiar ou com as pessoas muito mais próximas. Mais uma vez, eu digo que o caso específico de Moçambique, os casos reportados de uniões prematuras, ou aliás, os casos de violência contra crianças, sobretudo raparigas, baixaram muito, estão abaixo de 2.000 casos. Se compararmos nos anos anteriores, que antes da situação de lockdown.
Obrigado.
Okay,
please,
obrigado.
the interpreter to interpret for us. The interpreter, please. The Mozambique interpreter, please interpret for us.
Yes, he's here.
I don't know if you're able to hear me.
We can hear you. Please go ahead.
Can I go ahead?
Yes, please.
Okay, right. Basically, what Mir was sharing is that the situation of the impact of COVID-19 on child marriage is somewhat similar to Zambia and Zimbabwe. However, it was slightly different because in Mozambique, we did not experience lockdown as what happened with people from Zimbabwe. So what we had was some restriction on the movement of people, which also impacted on the economy, also in the family. But as regard to the statistic on the impact, according to official data, there are 2,000 cases are recorded of early marriage or violence, which were officially registered. But again, this seems not to somewhat reveal the truth, according to the reports from some partnering organizations which are closely working with the communities, which suggests that the situation can even be severe than that. True enough is that is the fact that the government has put in place a number of actions to address the problems that could arise, because of the pandemic situation, by providing, for example, an allowance to the families who were more financially vulnerable, so that the problems because of their financial situation would be prevented. In few words, this is what Vladimir has just shared.
Thank you so much. So I'm learning from Zambia, from Zimbabwe, and from Mozambique. The situation is almost the same. There's been an increase. There's been an obvious increase in child marriage cases across and teenage pregnancies. And it's as a result of a fluid child case management system, lack of services, and economic exploitation, because girls need to survive. And the only way to survive is either they get married or they sleep with someone and they end up getting pregnant. And then economic stress pushing girls to go and get pregnant or get married. So thank you so much. So my next question is I'm going to talk to Chief Chikumba. Chief Chikumbu from Malawi. So according to you, what is the experience in the mitigation of the impact of COVID-19? You've heard what the government people have said. They have said there has been an increase. There's been an increase because of economic pressure, because of a fluid case management system, because of lack of services, because of economic stress at the household level, pushing girls to go get married early, lack of hygiene kits, of menstrual health, or just simple ones. So according to you, Senior Chief T.A. Chikumbu, what is your experience in mitigating the impact of COVID-19 and on child marriage and teen pregnancy, at least in your chiefdom or in your country? What has been? What has been your experience?
The question?
Chief Chikumbu and Chief Pilipo, what has been, you've heard what the government people have said, there has been an increase, okay, of teenage pregnancy, of child marriage as a result of COVID-19, okay? And it's because of economic pressure, economic exploitation, a fluid case management system, lack of services, okay? So, and just pushing girls to get pregnant, okay, or getting married. So according to you, what has been the experience in mitigating the impact of COVID-19 on child marriage and teen pregnancy at your chiefdom level, okay? What are some of the best practices I can be able to share for the rest of us to be able to learn from? Senior TA Chikumbu.
Oh, thank you so much. Thank you so much. In Malawi and in my area, it is still similar to what our neighboring countries experienced. It was just the same. We experienced a lot of teenage pregnancies since there was a lockdown, but also schools were closed and the girls were at home and they were being abused by their relatives at home. Most of them, they were pushed into marriages, early marriages, of which we had experienced a lot of them being married. Just imagine in 2020, that was last year, early marriages were at an increase, about 13,000 cases of children, of girls being getting into marriages, into early marriages. So it isn't different from other countries. It was just similar. The services were down. There were no business was down. And most of the children, most of the girls, they engaged themselves into brothels. We experienced a lot of brothels which were born, and the girls preferred to go into brothels to work, and there were a lot of shabins which we had in our areas, but and most of the girls preferred to go and work there. And in so doing, most of them, they came back with teenage pregnancies, of which we reported some of these cases to the police, and they intervened through the government, and we saw that those brothels were closed, and with that, we managed at least to rescue some of them. That's what happened in during that time. COVID-19, we saw a lot of girls being in marriages, and that was because of there was a lockdown, but also schools were closed. That's why we had that experience.
Thank you so much, Chief Chikumbu from Malawi, and Chief Filippo. What has been your experience in your own chiefdom, okay, in mitigating the impact of COVID-19 on to young girls?
In my area, is it me or?
No, I'm talking to Chief Tanzania.
Oh, thank you so much.
Thank you. Our chief will be talking in Swahili, and we will have someone who will be who will be translating it into English.
Hamna shida, endelea.
Wakati wa COVID-19 imeingia, kamati za ulinzi wa mwanamke na mtoto ziliendelea kufanya kazi zake kama kawaida, kukutana kwa ajili ya vikao, isipokuwa kwa ajili ya kuepusha mikusanyiko ambayo ilizuiliwa na serikali. Ililazimika wajumbe wachache wawe wanahudhuria na kufanya hizo kazi. Kwa hiyo utekelezaji wa mpango mkakati wa kutokomeza mimba na ndoa za utotoni uliendelea kutekelezwa kama kawaida. Lakini pia
during the COVID-19, the Child Protection Committees continued to meet, although due to government restriction, only few members of the committee met so as to keep on getting information of what is going on in the community in relation to the ending of child marriage.
Pia kama viongozi wa kijamii tuliendelea kutoa elimu kwa jamii juu ya madhara ya mimba na ndoa za utotoni kwa njia ya redio, kwa kuwa kwenye eneo letu tuna kituo cha redio cha Pambazuko ambacho kinatoa hayo matangazo na elimu kwa jamii.
In our community, we have a local radio, so most of the time, we as traditional leaders, we get free sessions to create awareness in the community. So during the COVID-19, we used that chance to create awareness to the community on the harmful effect of child marriage.
Kadhalika tuliendelea kutoa elimu hiyo kupitia nyumba za ibada, makanisa na misikiti, ambayo pamoja na zuio la kukusanyika, lakini nyumba hizi hazikufungwa. Kwa hiyo elimu iliendelea kutolewa kuzuia na kutokomeza mimba na ndoa za utotoni.
The traditional leaders in Tanzania, although we had COVID-19 in our country, but most churches and mosques were not closed. So we as traditional leaders, we kept on creating awareness during the religion sessions.
Pamoja na hayo, tuliendelea kuripoti matukio na kesi kwenye vituo vya polisi na kufuatilia kwenye vyombo vya maamuzi, ambapo tuliripoti kesi 14 kwa kipindi hicho cha COVID-19, ambapo kati ya hizo kesi 6 zinaendelea vizuri.
During COVID-19, we kept on reporting the cases which were brought to us from the community members. We reported a total of 14 cases, and among 14 cases, 6 cases are in good progress in the police department.
Nashukuru.
Thank you.
Asante sana, nashukuru pia. So what I'm hearing from Tanzania, I'm hearing from the chief from Malawi, that the community leaders played a very important role in sensitizing the communities and reporting cases, okay, of child marriage. Also, at the media, the local media played a very important role. And I love what Chief Chikumbu said. ensuring that no child marriage by ensuring putting laws, local laws that ensures that no child gets married at her chiefdom. Okay, I'll go back to the government people. We've heard what at the community level the chiefdoms are doing. Okay, so but at the government level, what happened in your country to address the impact of COVID-19 on child marriage? So I'll start with Mozambique. What has been done in Mozambique sure that to address the impact of COVID-19, you've heard what the chiefs have said, what is happening at the community level, at national level, for example, at subnational level, what is happening to address the impact of COVID-19 on child marriage and teen and Damir, are you there? I don't think he's there. So I'll go to Zimbabwe. What is being done at that level to ensure that you have at the national and the subnational levels?
Okay, thank you. In Zimbabwe, we have what we call the National Action Plan and Communication Strategy on Ending Child Marriages. We are trying to accelerate the implementation of this plan. So to date, I think we have done, we are encouraging these community engagement meetings that we are currently conducting. We are also doing what we call, in the context of COVID-19, we are doing what we are calling mobile service provision, whereby we are trying to actually reach the communities by bringing the services to the communities. You understand that due to restrictions in terms of movement, people cannot access services. So we are trying to bring these services to the grassroots, whereby we are moving as teams. We will have the health personnel there to offer sexual reproductive health rights issues and services. We also have the police to deal with the law enforcement of cases of GBV and child marriages. We also have the psychosocial support services that will come along with the mobile services. We are also doing birth registration, that is mobile, bringing the services to the people. In terms of the retention of the girls in schools, I think as a government, we have what we have under the Ministry of Primary and Secondary Education. We have a policy that aims at promoting the retention of girls in schools. The policy is actually P35, if I'm not mistaken. Let me just have a look at it. But what it does, the P35 affords a second chance to those girls who have fallen pregnant. You are actually given a second chance in terms of pursuing your education priorities. So you can actually take leave whilst you are pregnant and maybe you need time to give birth. But as soon as you give birth, you are allowed the chance to continue with your education. So we are also promoting that policy. We understand that given the statistics that I have shared with you, we are going to have more of these children having babies. But at the same time, we want to make sure that these children pursue their education. So that policy is going to be more effective moving forward. We are also intensifying the resource mobilization agenda, whereby we want to promote the safe shelters. We understand that some of these children are actually in abusive relationships. They need a safe space whereby they can rebuild and maybe take hold of their life. So we are promoting the resource mobilization for our safe shelters and our one-stop centers, where we offer services which are GBV related. And also riding on the devolution mantra that we are having in Zimbabwe, where we are promoting devolution, we are engaging traditional leaderships. We are saying with the devolution, we are coming up with the local solutions for our local problems. So we have actually have a series of trainings that we are doing, or the engagement meetings that we are pursuing, whereby we're bringing all traditional leaders on board to come up with work plans to operationalize the NAP that I have talked about, the National Action Plan. So some provinces have already started in terms of their engagement of the traditional leaders, whereby we want to come up with a local plan that works for our local communities in terms of ending child marriages. And I'm happy that from where I come from, we've actually developed a work plan in consultation with the chiefs, and we are trying to then roll out that plan going forward. As government, again, we are pursuing the alignment of laws. You understand that we need to harmonize our laws, given that we have a new constitution that was ushered in year 2013. But you'd find that some of our laws are not in line with the constitution, whereby there are some laws that actually allow the marriage of a girl at 16. But we are saying with the coming in of the new constitution, we need to align our laws. So there's this process that is actually ongoing in Parliament, whereby we are aligning the laws to the constitution. There is also this talk of a marriage bill, which seeks to harmonize our marriage acts, so that we have a marriage bill that legalizes marriage at 18 years. So these processes are actually currently ongoing in the Parliament of Zimbabwe as we speak, and very soon we'll be getting results. We are also promoting the safety nets. You'd understand that when a child gets married, we are quick as service providers to go and rescue the child from the marriage. But what next? So we are trying to put in place mechanisms for safety nets, so that those who are in marriage find it easier to withdraw from that child marriage and actually fit into the safety nets that the government is providing. The safety nets are not only coming from the government, but we also have civil society organizations who are prepared to also offer these social safety nets. So we are also pursuing that one. In terms of information, we are continuing working with the Ministry of Information to cascade information on child marriages. So information dissemination is ongoing. So I think in short, this is what we are trying to do as a government of Zimbabwe and from the respective areas. Like I said, using a multi-sectoral approach, this is what we do in Zimbabwe. In short, thank you. That's what I can share for now. Yeah, Donna. Hello? Yeah, it was unmuted. Hello?
Hello, I think Jane must have dropped off. Let's just continue the discussion. Since we don't have the speaker from Mozambique, let me give the opportunity to Zambia in terms of your government. What have you done to address the impact of COVID-19 on child marriage? So over to you.
Thank you very much. I think for Zambia, most of what Zimbabwe has said is what is exactly that we are doing. So in order for me to avoid repetition of what he said, I will concentrate in the immediate actions that have been taken to curb child marriages during the period of COVID-19. So the quick response that government did was to try to stabilize the situation, to bring back all the services of service provisions to be functional. So what cabinet did was to let all the civil servants return, especially those in key areas like social work, community development, health, and education. They were brought back to start functioning and working so that they can provide services to especially the girls who were more at risk. Children later on were given a chance to go back to school. This gave hope to parents that their children, that wasn't the end of their education life. So this gave hope to the children as well to get back to school. Then the other thing that government did was to scale up in the provision of agriculture inputs so that they cushion the economic challenges with people in the villages and the farmers. So they scaled up in increasing the places where they give the inputs, even the number of people that are receiving the agriculture inputs. Then going forward, there was also the giving out of emergency social cash transfer to families that were highly affected by COVID-19. You may understand that most facilities were closed, and as in the case of private schools, teachers stopped getting paid. Even those people who offer services like in the small scale industry, they stop receiving their businesses. So emergency cash transfer is one of the move that the government did to help out so that people cannot concentrate in marrying off children, but stabilize in their businesses. And then the other thing is that Zambia has been part of the countries that has been sponsored by the World Bank in running the Girls' Education, Women Empowerment Livelihood. Zambia made a good deal where they've scaled up also the Jewel project. This is not the Jewel project. They've scaled up the Jewel project, not just in the selected district as it was in the past. Now they've scaled up to more districts in the country. In the case of Luapula, we had only about 2 or 3 districts that were receiving the Jewel project. The number has increased to 6, and only 4 districts are the ones that are not receiving the Jewel project. And because of that, the Jewel project aims at keeping girls in school and helping women's livelihood. And you know, when you help a woman, you help a mother and you help the whole family. And when you keep the girls in school, it means there is a reduction in teenage pregnancy and also the issues of child marriages. Then going forward again, under the Ministry of Youth, Sport and Child Development, the government is scaling up on the child protection committees. This is being scaled up into all the districts to increase the multi-sectoral approach. This will help to reduce the violence against children in all districts and even at community level. Then this year stands out to be a very different year because all the girls and the boys that wrote their grade 7 exams last year in 2020 were made to pass the grade 7 exams. This is a move to scrap off the grade 7 exams and give chance to the girls to further to attend their higher education. In most cases, they noticed that girls were dropping off at the level of grade 7. And when they drop off because they failed, they never used to come back to school, even if the Zambia still has the re-entry policy. But with this move to help the girls attend higher education through scrapping off the grade 7 exams, it will help many girls reach the grade 9 exams. And that is only 3 years before they finish their grade 12 exams. It gives them hope to repeat if they fail in grade 9, it gives them hope to repeat so that they can also attend further education. This also helps them as well to pay less because even the Ministry of Education also reduced the fees of paying in the lower grades, as in from grade 1 to grade 7, they completely scrapped off the fees of paying for their education. Just as Zimbabwe has said, Zambia is now enacting the Marriage Act because it was a bill for a long time. Now they're enacting the Marriage Act, meaning that no child will be married off below the age of 18. No person will be married off below 18 years and below. And 21 years still stands to be the most legal age for marriage. And also, Zambia has also been a signatory to a lot of international treaties. We've gone forward to enact them, to practice what we've signed. We have what we call the Child Code Bill, which will harmonize a lot of issues concerning children. And not only that, we are going to after harmonizing the issues of children, we are going to make sure that violence against children is reduced and child marriage is part of violence against children. lastly, I would like to say that Zambia also, and particularly Luapula and Northern Province, were under the sponsorship of the European Union in putting one-stop centers in all the districts in the two provinces. And because of that, the one-stop centers have been of great value and of great hope, especially during the time of COVID-19. That's why we get the statistics that the child marriage issues almost doubled, because reports kept on the increase. There was an increase of reports of child abuse, child marriage issues, teenage pregnancy, and this generally sexual gender-based violence. So basically for Zambia, I think I'll end here, but this is majorly what we have been doing, and we look forward to do more as a country. Thank you.
Wow, Zambia, I just love your energy, man. We all clap for each other.
Thank you, that's our spirit.
Thank you so much. So I'm hearing like policy change, okay? Like the back to school policy from governance, sensitization, aligning legal framework like the constitution to ensure that the definition of a child is below the age of 18. Okay, direct entry for, I love the is it Zambia or Zimbabwe, where girls are allowed to go to school. They skipped grade 7 and went to high school direct. That is an amazing policy. I think one of the best one I've had so far. So the community engagement meeting. So all these efforts that are being done. So there's a question. All of us are talking about an increase in the number of child marriages. Can we say, for example, 2019, how many were the cases? Were they 2? And then they jumped to 20 in 2020 as a result of COVID-19. What are they? Okay. So what are those? What is that spike? Okay, this is the first question. I think it was from someone. So, and if we have any questions to the chiefs or to the government officials who have just spoken, please lift up your hand, and you'll be allowed to speak from where you are. So from, like, for example, it's in Zimbabwe, you gave us numbers, 1,000 something that have gotten married, 4,000 who are pregnant. So what is the percentage increase from, if you compare 2019 and 2020? Zimbabwe?
I would say, because from the last survey that we had, if you look at our prevalence rate was 31%. As of now, I think we can say we are now at 31%. So in terms of statistics, yes, there is an increase, maybe 2%, 31 to 33, yeah. Hello?
Thank you. So it has increased by 2% from 31 to 33%, the prevalence rate, right? So, yes, and what about Zambia? What is the prevalence rate of teenage pregnancy and child marriage compared from 2019 to 2020?
In the case of Zambia, I'll take statistics from the reports that were coming basically on sexual gender-based violence, that is combining teenage pregnancy, early marriage, and child abuse. Reports doubled. By that I mean that teenage pregnancy doubled, but reports doubled because all the reports put together, they doubled as in daily reports. These reports are taken from victim support unit from Zambia Police and one-stop centers. They recorded a double report because during the time of the lockdown, people were staying more at homes. So there was a lot of violence against women and violence against children. So that's the statistics at the moment that I can share with confirmation that the reports doubled, and then after the lockdown, the numbers started improving. Official reports, maybe I could share at some other time. Thank you.
Thank you so much. As we finish up this particular session, it's been very, very, like I've been writing notes throughout. So we have spoken about solution. We are talking about the issues and some of the solutions that you guys, some of the innovative ways that you have come up. Some of the come up to address the impact of COVID-19. Some of the policy strategies that you have come up to address the impact of COVID-19 on teenage pregnancy and child marriages. As we move on, as you can see, it is estimated we are going to, the last time we are going to hear anything about COVID-19 probably be 2023. That's when you can maybe hear it's finishing, okay? So as we move forward, what are some of the things that we need to look out for so that the efforts that we have made over the last decade or so are not watered down? I'll start with Zambia because I can see your eyes. What are some of the things that as we move forward, what are some of the things that needs to be done urgently and in the long term for us to be able to deal with this issue so that some of the efforts that we have done to end child marriage are not watered down? Zambia?
Thank you very much. Can you hear me?
Yes, I can hear you.
Okay. Basically, I think some of the things is we need to continue in sorting out the issue of child marriages in a multi-sectoral approach, because government alone cannot get rid of this issue of child marriages. So as we have started, like in Zambia, we have started engaging the chiefs. We need to continue working with the chiefs because they are the custodians of the tradition issues and even the lands. So engaging the chiefs, and they have so much respect in the community has so much respect in the chiefs. Once the chiefs are on board, the chiefs are working. Whatever we do, I think it will have a long-lasting project, a long-lasting. Yes, there will be success in what will be happening. And then also, one of the things that I felt, I couldn't mention earlier on was that we've increased even in media outreach, through radios, through televisions, and even Zoom meetings. This has also helped us to reach out to have meetings even where there is we can't reach people. So this has also helped a lot. So this needs to continue even after the time of COVID-19. We've seen how much impact media outreach has been. So these are some of the things that we can talk about. When we talk about the multi-sector approach, all the institutions, both government institutions and private institutions, we need to continue to work together, see which institution, how much it can do and where it will reach and where the other institution can continue. Without this multi-sector approach, I don't think we are going to go anywhere. Thank you very much.
Thank you very much. What about Zimbabwe? So I'm hearing from Zambia, they're saying a multi-sectoral approach. Ending child marriage is not a one-man show or a one ministry show or one government agency show. It needs everybody in. Engaging of chiefs, and that's one of the reasons that we have this particular exchange meeting, and then increase of media engagement. What about in Zimbabwe? What as we move forward? Because as we hear, COVID-19 is evolving and it's changing the way it looks like. So we might be in this state for a while. So what are some of the things that we need to do to ensure that the things that we have done over the last decade of ending child marriage and teen pregnancy is not watered down? Zimbabwe?
Okay, thank you. For us, I think a lot has to be done in terms of economic empowerment, whereby we are saying the families themselves should be able to sustain themselves and also have that disposable income to actually keep the retention of girls in schools. So for us, economic empowerment is key. And also you'd look at the need to strengthen the GBV management information system for us as Zimbabwe. We are saying we need to come up with data collection tools that promote data integrity in terms of bringing evidence-based programming. So for us, we need to also work on having a management information system that actually collects accurate, precise data, so that when it comes to programming, we know what needs to be done, where, how, and when. I think that can only be done once we have a clean management information system. I would also talk about the resource mobilization. We also need to pursue that one as well. Yes, as government, we have what we call BEAM, Basic Education Assistance Module. So we want to enlarge the cake or the number of children that are assisted under BEAM. So we are saying from the government perspective, more allocation should be directed towards the basic education assistance module so that more girls can actually be covered under this module. And resource mobilization for the CSOs is also key so that they can also come in with those safety nets that I've been talking about, that we need these safety nets to actually respond to cases of child marriages when they occur. And maybe lastly, I'll talk about the need to have access to SRIH. We need to also widen our scope in terms of giving services along this issue. I think for me, that's what we can do for now.
Thank you so much, Tanzania. So, Chief Chikumbu from Malawi, you're doing a commendable job. You're doing a commendable job, and you've heard from the government counterparts what they want to be done. But from the chief perspective, from your chiefdom, or from a traditional leader perspective, what do you think we should do as we move forward so that all the efforts that we have done, and I know, Chief, you have done so much, I've read so much about what you have done in Malawi. So what should be done so that all those efforts that you have done should not be watered down, that girls continue going to school, girls don't get married early? What needs to be done? Chief?
Thank you so much. I think what we have to do now is we should have a good coordination now with all other chiefs. We have to work together. And in our chiefdoms, I think we need to engage the committees we have and also the government as well. Of course, we have those NGOs who are working with us. For example, Planning is with us, but still we have to work together, all the chiefs in the area or the chiefs in the district as well, so that at least things should go well, we should at least make an improvement. I know that COVID, we can't just say today COVID is not there. No, COVID is still there. But with this, we have to hold hands now to work together. At least things should go well. We have seen our girls, most of them, they have gone back to school, and some of them, they are now engaged in other activities, like some businesses, which are being, they are being empowered by other organizations. And with that, I think we need a lot of coordination now. Thank you.
Thank you, Chief Chikumbu. I hear you. We need coordination between government agencies, between chiefs, between CSOs and NGOs that are working around teenage pregnancy and child marriage. Finally, going to Tanzania, and as you answer this, Tanzania, I also want you to introduce yourself and someone to introduce the chiefs in Tanzania. So because we had a session earlier, but you were not able to engage, so we need someone also, as the chief answers this question, what needs to be done, we also need someone to be ready to introduce the rest of the chiefs in the room. Chief Filippo?
Kwa majina naitwa Filippo Komba, kiongozi wa kijamii kutoka Tanzania.
He's saying, my name is Filippo Komba. I am a traditional leader from Tanzania.
Asante. So swali langu ni Kiswahili kimeisha. What would you want to see? Like, umefanya kazi nyingi sana kumaliza mimba za utotoni za wasichana wasiolewa mapema. Unataka ifanywe ndio hii COVID-19 isiharibu kazi ambayo umefanya kwa miaka yenye umefanya kaa 10 ama kama 5 umefanya ya kumaliza mimba ya kusitisha mimba za utotoni na kusitisha watoto wadogo kuolewa? Nini unataka kuona ifanywe katika Tanzania?
Tunataka kwanza tuhakikishe kesi zinazoripotiwa zinafanyiwa kazi kwa haraka na kuchukuliwa hatua.
The cases which we report, we wish that they should be executed and taken care.
Lakini elimu iendelee kutolewa kwa wazazi na kwa jamii na watoto wenyewe ili kuendeleza uelewa wa madhara hayo ya mimba na ndoa za utotoni.
We wish that we continue to create awareness from family level to community level and to national level, even the youth, on the harmful effects of child marriage.
Lakini kuendelea kufanya uhamasishaji.
Allowed to have community meetings, or we will keep on doing community meetings, and also the use of local medias at our community, so as to create awareness on the harmful effect of child marriage.
Kuendelea kutekeleza mpango mkakati wa kuzuia mimba na ndoa za utotoni na kupitia kama kuna marekebisho yoyote ya kufanya.
We have the National Action Plan, which is adopted from national level to community level. So we wish to keep on implementing this action plan in our communities, as its objective is to end violence against women and children.
Lakini tunaomba pia plani international iendelee kusapoti shughuli za uhamasishaji wa jamii na kutoa utambulisho wa umuhimu wa huduma rafiki za afya kwa vijana.
We wish to keep on advocating on the importance of having friendly health services for youth, as we have the service centers, but usually designed for adults only. So we wish to keep on advocating for the importance of having health-friendly services for youth. Also, we wish that Plan International to keep on supporting us in our advocacy activities.
Asante.
Thank you.
Shukran. Nataka mtu atujulize chiefs wengine wa Tanzania wako kwa hiyo room. Naomba tafadhali mtu anisaidie kufanya introductions. Interpreter, please introduce for us the chiefs who are in the room, apart from the Chief Philippo.
Habari za kazi. Mimi naitwa Jumanne Athmani Kipembe. Kwanza ni mzee maarufu, halafu ni kiongozi wa dini ya Kiislamu.
My name is Jumanne Kipembe. I'm an influential person in the community, and I am a religious leader of Islamic religion.
Kutokana na masuala haya tunayoendelea nayo kuhusu kupata mimba vijana ambao umri wake haujafikia na kuolewa, ninachokifanya au tunachokifanya kwa ujumla ni kuzidi kuendeleza utaratibu tulioanzisha ili kuweza kuwaelimisha watoto, kuwaelimisha kina mama, maanake wazazi, ili waweze kujua hasara ni nini, aidha watakachokipata baadaye ni nini. Mara nyingi sana mimi au sisi huwa tunatumia muda mwingi tunapokuwa tumemaliza swala, ndipo tunapotoa na maelezo kuhusiana na vitendo hivyo vya mtu kupata ujauzito kabla ya kufikia umri, hatari zake ni zipi.
In my religion, usually after religious sessions, we use some of the time to create awareness to the people who have attended on the harmful effects of child marriage.
Halafu kitu kingine huwa tunajaribu kuiomba viongozi wa serikali kunapokuwa na vikao katika vitongoji, huwa tunawaomba ili tuweze kupata nafasi ya kufikisha masuala hayo kuhusu athari zinazoweza kumpata binti atakayepata ujauzito kabla ya wakati kufikia.
We usually request for government leaders to give us a chance in their meetings to speak so that the community also can hear us. Thank you.
Asante sana.
Asante sana, nashukuru. Kuna chief mwingine?
Kwa jina naitwa Henrik Ngukila, ni kijana maarufu au mzee maarufu.
During the traditional ceremonies so that they avoid unnecessary habits which might lead them to get pregnant at early age.
Asante.
Nashukuru.
Asante. Naitwa Kulwa Kikopa, afisa mtendaji wa kijiji. Mimi kwa nafasi yangu huwa napokea kesi kutoka kwa kamati yangu ya mtakuwa ambayo inajihusisha na kusimamia au kupinga ukatili wa wanawake na watoto na kusimamia sheria ndogo kwa kufikisha katika vyombo vya maamuzi kwa maana ya polisi na mahakama.
My name is Kulwa Kikopa. I am a village executive officer. Most of my role is I receive cases from my community members and I make referral to the police department.
Lakini pia uhamasishaji katika ya uzalishaji mali pamoja na makundi yote yaliyopo kijijini ili waweze kujua athari za mimba na ndoa za utotoni.
We do create awareness to all the groups in the community, from youth, parents, even entrepreneurship groups.
Okay, thank you.
Nashukuru.
Asante. Kwa majina naitwa Martha Nyangara, afisa mtendaji wa kijiji cha Ihanga.
My name is Martha Nyagara. I am a village officer.
Mimi nitakuwa huwa anakwenda shughulikia tukio.
I have a very active child protection committee in my village, which usually reports different cases and sometimes themselves.
Na ndio maana hata sasa wananchi wengi wanauelewa, hivyo mimba na ndoa za utotoni zimepungua kwa kiasi kikubwa.
In my community, a lot of community members have a big understanding on the harmful effect of child marriage. So everyone is aware of the harmful effect of child marriage.
Asante, nashukuru.
Nashukuru.
Thank you.
Oh, that's it.
Yes.
Yeah. Okay. Nashukuru, asante sana. I'm going to give back this meeting back to Meti, who is going to give us directions for Meti.
Thank you, Jenny, for the successful deliberation of the previous session. Thank you, everyone, for your active participation. And now I am going to announce that we will have a lunch break. It was supposed to be for 1 hour, but we will commence from that on. Thank you so much.
2:45. Please, it's 2:45 South African time.
Oh yeah, sorry, the time difference for us here in Addis, it's almost 3 now. So yes, 2:45, please. Thank you. I hope my message has been, yeah. Jenny, can you hear me?
Yes, I can hear you. So we are back at 2:45.
Yes.
Okay, bon appétit, Jenny. Thank you for the great
Merci, merci.